My name is Dr. Buford Moore. I'm a plastic surgeon and a COVID survivor. Well, one of the most important and instrumental people in my recovery was Barbara Rogers, the director of the ARU.
So the ARU, acute rehab, is so different than the therapies or services that you might receive at an LTAC level or even a skilled nursing level because of the intensity of therapy that we do. Our programming involves 3 hours of therapy a day. We have the best physical therapist, the best occupational therapist. Every nurse was interviewed and hired specifically for this unit, for this job.
Opening an ARU in this hospital was awesome because the great thing is the patients transfer to a higher level of intensity and duration of therapy, but also they keep all the same doctors.
Having that flow of care between units and physicians, I think that makes all the difference. You know, they knowing what he did for a living and what things were important to him and tailor his therapy goals towards that is very important, I think, in anybody's recovery.
Dr. Moore is a doctor, he's a hand surgeon. And when he came to us, he could barely squeeze his fingers. He could maybe only do that. He was very tight.
When I was in practice, I did a lot of microsurgery under repairing nerves, things like that. And I'm beginning to see now that with the things that they've had me doing, that might be possible for me again. Between simple exercises that they gave me that I could do myself and supervised exercises like using a therapy, and there was equipment that they would bring to try to get my hands to move. I wouldn't be where I am as quickly as I am without those guys.
When you have a team on an acute rehab unit that knows what they're supposed to do and they work as a fine-tuned machine, you have outcomes like Dr. Moore. He wheeled into this hospital as a quadriplegic, couldn't walk, and he truly walked out of this hospital. He's on a journey to go back to work.
They provided me with a lot of tools to work on my hands and regain the sort of dexterity that I need to be a surgeon again. 2 months ago it seemed impossible. Now it doesn't seem impossible that might happen.
It makes me feel like we did our jobs. It makes me feel like we are impacting our community. We'll do it one patient at a time, one day at a time.